Hi, my name is Jonathon Lebovitz, and I'm a neurosurgeon at Elite Brain and Spine, and I specialize in cerebrovascular neurosurgery. There are up to 6 million Americans currently living with brain aneurysms. Most of them will never have an aneurysm rupture or need an aneurysm treatment. Brain aneurysms are weaknesses in a blood vessel within the brain itself. They usually form an outpouching or a balloon or a sac that is off of sometimes a bifurcation or where two different arteries meet. And these thin-walled, weak-walled areas will balloon out and at times can bleed or rupture. Some warning signs of brain aneurysms could include headaches or increasing headaches, signs and symptoms of a stroke such as weakness, a numbness, a tingling, difficulty with your vision or speech. There are aneurysms in some location that could cause your pupils to be irregular or the dark parts of your eyes to be different sizes. Today, we're able to treat most brain aneurysms in a minimally invasive way through either the blood vessel in your arm or the blood vessel in your leg. After a diagnosis of a brain aneurysm is made, we normally come to the office and talk about it and look at your pictures, including a CAT scan angiogram or an MR angiogram, however it was diagnosed. The next step is we perform a formal diagnostic cerebral angiogram where we place a small catheter through the artery in your arm and bring that small catheter tube up to the arteries in your neck, where using a special x-ray machine and contrast, we're able to get better pictures of your blood vessels, including the brain aneurysm. This procedure takes between 20 and 30 minutes. It's done as an outpatient and you're able to go home the same day with minimal recovery other than a sore wrist for the next day or two. At that point, we can come back to the office and review your pictures together and determine if treatment is necessary. Most brain aneurysms today we're able to treat through the blood vessels of your arm or your leg in a minimally invasive approach. We're able to pack off the aneurysm from the inside with a series of small metal coils, or sometimes use stents in addition to the coils, or other times can just use a special stent that lets the blood vessel remodel, excluding the aneurysm from the circulation. The overall goal of our aneurysm treatment is to not allow blood to flow into the aneurysm, therefore it will no longer be able to bleed or cause you a problem. After a minimally invasive or endovascular brain aneurysm procedure, we generally ask our patients to take it easy or lay low for the next week or so. Again, most of the time they just have a little soreness in their wrist and have a small band-aid as their bandage, but we do like to remind them they did have brain surgery and they should allow their body to heal and recover over the course of a few days. If we're able to catch your brain aneurysm prior to it bleeding and you undergo a successful treatment, life goes back to normal. There's no further worry or risk factors that you have to worry about for your brain to have an episode of bleeding or neurologic episodes. We generally will perform a follow-up angiogram 3 to 6 months after your initial procedure to check our progress. If things look good, at that point we can follow you with non-invasive imaging such as MRIs. Once again, my name is Dr. Jonathon Lebovitz. I'm a cerebrovascular neurosurgeon here at Elite Brain and Spine. If anyone you know or family members have a strong family history of brain aneurysms, a new diagnosis of brain aneurysms, or increasing headaches, please give us a call and we'll be happy to help.